Not visible, sir.
Cognitive behavioral therapy or cognitive behavioral approach that we will discuss today. In psychodynamic theory, previous unit, we discussed about the some conscious, subconscious, unconscious, that is topology of mind and the structure of mind. Then it is some defense mechanism and some stages of Sigmund Freud's uh, lifespan. Okay. So here in this CBT, or you can say cognitive behavioral therapy, uh, yes, we have cognition. Cognition means thought process. The cognition means thought process. In CBT, so here the first premise that is psychological, what are the dysfunctioning in the mind? What are the dysfunctioning in the thought process? Okay. So here, these cognitive behavior therapy is the base of the cognitive behavioral therapy is behavioral theories. Like as I mentioned the previous class, there are different behavioral theories. One is operant conditioning theory and uh, this classical conditioning theory. Then social learning theory is developed by Albert Bandura. Okay, here in this CBT, the main uh, backbone, the main foundation of cognitive behavioral therapies, behavioral theories only. Okay, here cognition is thought process. So in this CBT, we need to check whether the clients or the subjects or the individuals, how the cognition, how the thought process, okay, whether the thought process is in the systematic way or the functionings of that particular case is in a systematic way or not. That we have to check. There are different forms of cognitive therapy. One is rational emotive therapy or rational cognitive therapy. Second is one framework is that is ABC model. Cognitive therapy, we have different forms of cognitive therapy. One is rational emotive therapy, then ABC model. Another one is empirical therapies. Okay, first of all, only these two we need to discuss. One is ABC model. Second is rational emotive behavioral therapy. Rational emotive behavioral therapy means whether our emotions are in a rational way or in a logical way or not. Okay. For example, without any reason, without any cause, without any purpose, if the individual is having some sort of emotional disturbances, we have to check whether that emotions are having any logic or not, whether they are having any rationality or not. Okay. So if it is not if you don't have any rationality behind that emotions, or you can say anger, fear, jealous, These are all the some emotions. Emotion, the term emotion derived from the Latin word emovere, Emovere, which means stirred up state, Stirred, stirred up state, or arousal state, disturbed state. When you are in the emotional disturbed state, our cognition may be adversely impact. The adverse impact is on our cognition because of our emotional disturbances. That is the reason the term itself is known as the stirred up state, stirred up, disturbed state, arousal state. There are positive emotions and some are the negative emotions. Positive emotions like happiness, joyfulness, okay, sociability. Negative emotions means jealous, anger, disgust, fear, anxiety. So we have more negative emotions than positive emotions. Okay. So here in this emotional disturbance state of any individual, in emotional disturbance state of any individual, the cognition, the thought process also will be disturbed. We may not be in a position to think in a systematic way, in a logic way, in a rational way when we are in the disturbed state. So because of our emotional disturbances, our thought process will be disturbed. When the thought process is disturbed, automatically our behavior also disturbs. The behavior means like our face expressions, the way we talk, the way we discuss with others, the way we mingle with others, the way we think, the way we behave is also disturbed because of our emotional disturbances. So here, rational emotive behavioral therapy, as I mentioned, this is one form of cognitive therapy or cognitive behavioral therapy, CBT. In this CBT, in this rational emotive behavioral therapy, we will check whether his emotions or her emotions are in logic way or rational way. So we need to modify that cognition, or you can say restructuring of their cognition. So if you want to restructuring their cognition, we have to check their emotions. Because of that, based on their emotional disturbances only, the cognition also, the thought process also disturbed. So in order to restructuring their cognition, in order to shaping their cognition thought process, we have to use this rational emotive behavior therapy, REBT. So that they think their emotions, for example, without any reasons, they'll have some sort of examination fear. The reason of examination fear is, so their behavior means they are not prepared for examinations within the time manner, within the time it is span. So here the behavior, if you want to modify the behavior, so we need to tell them, so better to study well, better to have some sort of it is good habits, or you can say study habits, in order to rationalizing their fear. So these are the things we need to modify. So rational emotive behavior therapy, emotional disturbances, whatever the emotional deteriorations, emotional disturbances, we have to change these illogical emotions to the logical way of thinking. So when the cognition is in a systematic way, automatically the emotional disturbances will be set it out. So both are interconnected, emotions and their cognition. Automatically, based on this both emotional disturbances and the cognitive deteriorations, their behavior. So in order to modify their behavior, we have to check both of these, cognition as well as the emotions. Okay. For example, some that is patients, their thought process will be like that because I need to do it, but I couldn't do this. I have to do this. I should statements. I visit my family every time that they want me to. They should do what I say. Is it possible they should do what I say? So is it possible to command or of the family? So this type of thought process, this type of illogical thing, this type of illogical cognitive aspects. So we need to check, and as a counselor, we have to modify their thought process. That means restructuring of their cognition. Cognition means there are different components in cognition. One is knowledge, understanding. Okay, so their understanding, if it have any, if it any need to change their understanding, so we have to change it. That means you are restructuring the cognition. In order to shaping their cognition, in order to restructuring their cognition, if there is any illogical emotions, irrational emotions, those irrational emotions better to modify in a rational manner, in a rational way, a logical way. So that is one form of therapy, that is cognitive therapy or rational emotive behavioral therapy to modify their thought process, to modify their behavior. Another one is that ABC framework. ABC framework means A stands for activated event, B is behavior, emotion and behavior, B. C is the consequences. In ABC framework, in ABC model, A is activated event, B is behavior, C is the consequences. Okay. So as I mentioned, behavior is depending on the in emotional disturbance state. Automatically behavior also in systematic, not in systematic, it's some sort of abnormal behavior the individual shows. So B is activated event, B is behavior, which connected to their emotions. C is consequences. Okay. So for example, activated event, behavior, and consequences. Some that is people, they will act in a different way because of their emotional or cognition, emotional or behavior. So emotional behavior, due to their emotional disturbances, their activations or activities, activated events. In order to change their activated events, the behavior and the cognition to be changed. When the emotion, for example, if emotionally disturbed person, his activities, his actions, his activated events, always will be in the negative manner, negative way, because of their negative emotions. So negative emotions with negative behavior, abnormal behavior leads some sort of negative activities or actions or activated events. The root cause of their activated event is their negative emotions and negative behavior. So what happens? They'll do some abnormal activities or illogical activities, irrational activities of their irrational emotions. So the consequences, when we explain the consequence by doing those activities slowly, their behavior may be modified. And some people, they wrongly or they negatively believe that by smoking or by taking some sort of substance, their stressful conditions, their stress will be released. They will have some sort of relief by taking this type of substance like cigarettes, alcohol, or any other drugs. They believe that, they negatively believe that, they negatively think that by taking this type of substances, they will have some stress relief. So the activated event is that taking the, using the substances, using the drugs, using the alcohol, using the cigarette. What happens? The consequences is that slowly, their health will be disturbed, their financial conditions, their social status, their job. These are all the negative consequences they need to face by doing this type of negative activities or negative activated event. So that negative activated event is based on their negative emotions connected with the negative behavior. So A is depending on the B, that A and B, by doing these activated events, by believing that by his or her negative emotions, they need to face the consequence of the negative only. In ABC model, so clearly, whatever their belief system leads to the activated event because of their disturbed emotions. They believe that by taking this type of drug or any substance using, we have some sort of pleasure or some sort of stress relief. The stress will be relieved by taking this type of drugs or substance. That is their wrong belief system. This wrong belief system, based on this wrong belief system or negative belief system, they will use that substance, that is the activated event. What happened? This activated event leads some sort of negative consequences. That is the reason in the addiction cases, generally what happens, we will explain that various negative consequences by taking that, by using that drug, alcohol, or any other substance. One is that financial consequences. By taking daily, by using daily some substance, they need to spend some 600 to 700 rupees or 1000 rupees per day. Their monthly income is around 20,000. Let us say it is 20,000, or you can say 25,000. Okay. If he spent around 6 to 700 or 500 rupees per day by using that alcohol or any other substance, what is the monthly amount he has to spend on only that particular substance? Means around per day, if it is 500 rupees, 15,000 rupees they need to spend on this only one is habit, that you can say substance. So whatever the remaining family expenditure, that we will explain. That means negative consequence of financial negative consequences, financial loss by using this substance, by using this alcohol, by using this or any other this drug or any. Number one. So by explaining this type of negative consequences related to the financial, that is one thing. Second is that family consequences. So the family members of the particular family, They also disturbed by using a particular drug to this particular case, in this particular. That is the family consequences, family negative consequence also explained. Third one is that health issues. The person who uses this, who is habituated to this drug, maybe he won't take proper food. His total lifestyle will be disturbed. So by disturbing his own lifestyle, definitely the health consequences, health disturbances he has to face. That is the third negative consequences of this particular case. Then job place, workplace, work disturbances. That also we have to explain when we are counseling this particular person doing having this type of habit. One is belief system. Based on the belief system, he is activated the events, that's the actions or activities. In ABC model, C is the consequences. Those negative consequences we will explain to the client. Same way, if he stops that by believing in a positive or a mild, if I take this type of, I'm habituated to this particular drug, these are the consequences, these are the negative consequences I have to face. By modifying his behavior, if he stops using that substance, if he believes, or if I stop this taking of this particular substance, so positively if he believes, so this is harmful to my health, that is the positive belief system. So here, if you change his, if we change his cognition, that means thought process, by stopping that particular usage of drug or any other substance, so the consequence will be positive. So this much of amount I will save per month, like 15,000 amount I am spending now. If I stop this particular using of this particular substance, so this much of amount may be in a position to save. So if he believe his modification of his behavior, by modification of his behavior, by thinking in a positive manner, so the activated event is maybe it may be stopped. So this activated event may be stopped in a day or 1 week or 1 month. Slowly, 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 the consequence will be in a positive manner. Okay. So this is one important framework, or you can say cognitive therapy in this CBT. One is REBT. Second is, especially as I mentioned, the REBT, rational emotive behavioral therapy, or you can say REBT, the irrational thoughts, irrational emotions. For example, if few unrealistic ideas or irrational beliefs are ruled the particular person. For example, I must do well and win the approval of others. So this is one type of irrational thought, irrational belief system, irrational it is cognition, negative cognition. For example, I must do well and win the approval of others for my performance. So is it possible to get this approval from all other members in the group? So it's not possible. That is the irrational system of thinking, irrational thought. So another irrational thought is that I must get what I want. Is it possible? Whatever you want, is it possible to get it? Those type of irrational thoughts, irrational belief system, irrational emotions. It's not possible to get all these things. That is irrational way of thinking. So because of their irrational way of thinking, their activities. So we need to modify, restructuring their thought process. That is the CRT. Another important technique in this CBT is CRT, cognitive restructuring therapy, cognitive restructuring technique. So we need to restructuring their cognition, restructuring their thought process, restructuring their. understandings. Got it? Hello, am I clear? Am I audible?
You are audible, sir. Can I have one doubt clarified?
Yeah, yes, yes.
Sir, in this cognitive behavior therapy or CRT or
Mm-hmm.
substance use, we are telling that we have to explain the
Mm-hmm.
consequences. By if you
Yeah.
take this, this will happen, this will happen, this will happen.
Mm-hmm.
Now, my doubt is, my feeling is, in addition to explaining, something else
Mm-hmm.
should be there. Because I'll give one example. You know
Okay.
that smoking is injurious to health. You
Yes,
know, it's
yes.
so widely, wherever you go, whether it in the movies or drinking is injurious, etc. It is said that now I do not have the figures. By taking up this huge campaign, this is in a
Mm-hmm.
societal way, not one to one.
Okay.
Whether really the number of smokers as a
Mm-hmm.
percentage of population has come down, I do not know. That's why I'm seeking your
Mm-hmm.
guide address.
Yeah. See, figures I can't give exact figures, but
Sir,
one thing I can tell you.
sir, sir.
So definitely there is a chance of reducing the intake of that particular alcohol.
Right, sir.
Or, see, in my experience also, some cases, if you visualize that one technique of visualizing what is going to be happen in their family, what is going to be happen in their personal life, what is going to be happen in their health aspects. If you explain these things, explanation means, see, as I mentioned, counseling. Explanation is different, telling is different, giving information is one type. But so proper counseling, if you if you provide in a right time with the competent counselor or expert,
Sir,
there is a chance of reducing that intake. But some cases they will stop, and there are chance of relapse that habit also. So
right.
there various steps we have to do. It's not possible to one day or 2 day. Nearly 10 to 14 sessions we had to give. Uh, there are some stages also in giving counseling to this particular case of alcohol or any substance abuse cases. There are some these techniques. You mentioned the techniques also in your book also. One is identify your belief system. There are some techniques mentioned in this. So
Mm,
identify your belief system first. We have to identify. You need to ask the client. We need to ask the person. You just check your belief system whether it is correct or not. Don't force him to understand. Just tell him.
I see.
So by using some empathetical techniques, empathetical understanding, ask them to identify your belief system, whether this belief system is in a logical way or illogical. Irrational or irrational. Irrational is there. Irrationality is there in their belief system. Better to ask them to try to modify their Indian system.
Right, sir.
That is one thing. That is
Right.
identifying our belief system, number one. Number two, evaluate the consequences. Ask them to evaluate the consequences. So I repeat, don't explain from our end. Try to empower the person.
Right.
Okay, by asking that particular case. So you just, for example, just you can ask the particular case. For example, as I mentioned, per day he spends his monthly income is around 25 to 30,000. Let us say it is 25,000.
Right.
Okay, he's a private employee or any other skilled worker. His monthly income is 25,000. Just to ask him, we need to ask the particular case, how much amount you spend on this particular this addicted substance, you can say alcohol in it. For example, if he says, sir, I need to spend some 400 to 500 rupees. Ask him to calculate 400 per day. So what will be the total cost of the 400 per day, the month wise?
Yeah.
So roughly he will tell is 12,000 rupees. So
12,000.
his monthly income is 25,000,
Yeah.
having some children of 2 or 3 children. So ask him to calculate the monthly rent of his house. That is some around 4,000 to 5,000 rupees.
Mm,
Okay. The other expenditure of his own, that is household expenditure, maybe some 10,000 rupees. Here, 10,000 is for his household expenditure. Rent is 3,000 rupees, 13,000 rupees. He spent only on his particular, that is addicted or any substance, is 12,000. What about the remaining, that is things? Maybe fees, children fees. Just ask him to
Right.
identify, or you evaluate the consequences. One is identifying your belief system. His belief system is that by doing this, by having this, why I am telling this example, some cases of like some private employees or some, in both cases I'll explain. So their belief system is that by doing this, by taking this alcohol of some, it is some quarter, like, okay, some 400 to 500 rupees they need to spend per quarter, as far as my knowledge is concerned. Okay.
Certainly.
So they think that after completion of their work, they'll have some sort of what is relief. Repeatedly, I'll ask the particular cases. నేను అడుగుతా ఉంటాం వాళ్ళని. So why you take this? Why you are habituating to this particular? Their answer is, సార్ నేను అలసిపోతాను నా వర్క్ లో.
Right.
సో ఇంటికి పోతా ఒక క్వార్టర్ తీసుకొని ఇంటికి పోయి తాగుతాను సార్.
Right.
ఎంత కాస్ట్? ఇట్ ఈస్ 400 rupees కాస్ట్ అవుతుంది సార్. సో his belief system is that by taking that particular drink, so he will have some relief. ఆయన చెప్పేది ఏంటంటే, నేను తీసుకోవటం వలన ఐ హ్యావ్
Relief.
సమ్ సార్ట్ ఆఫ్, ఎస్,
Yeah.
నాకు కొంత ఫ్రీ వస్తుంది, నిద్ర వస్తుంది, సంథింగ్. సో దట్ ఈస్, యాజ్ ఐ మెన్షన్, దట్ ఈస్ హిస్ బిలీఫ్ సిస్టమ్. So here ask him whether this belief system is rational, any rationality or irrational belief system. That we better to ask him. Where other sources are there? If you want really, if you want to get some sort of it. ఇంటికి రాగానే పిల్లలతోనో ఫ్యామిలీతోనో కూర్చొని ఒక టీవీ చుట్టము, వాళ్ళతో కొంచెం చిట్ చాట్ చేసుకోవటము, దట్ ఆల్సో గివ్ వన్ టైప్ ఆఫ్ రిలీఫ్, నో?
Yeah.
సో దోస్ థింగ్స్ వీ హ్యావ్ టు ఆస్క్ ఇన్ హిజ్ లెవెల్. ఆయన లెవెల్కి వెళ్ళి మనం అడగాలి. Because he is not that is skilled person, or you can say his earning is around 25 to 30%. So just ask him various questions. You believe only this is only the mode of system of, or only way of getting relief? And adiginappudu, then he will think, in case, is there any other ways? Is there any options of getting relief? You got it? Am I clear? So this is the way. Ask him to understand. Ask him to check his belief system. Ask him to identify his belief system is rational or irrational. సో హిస్ వై యు ఆర్ టేకింగ్ దిస్ పర్టికులర్, ఎందుకు నువ్వు తీసుకుంటున్నావని అంటే, ఆయన చెబుతున్నటువంటిది ఏంటంటే, నాకు కొంత అలసిపోతాను, నేను జాబ్లో అలసిపోయి ఇంటికి వస్తాను, కాబట్టి ఆ 300-400తో నేను అది వాటర్ తీసుకొని తాగి తిని పడుకుంటాను. మార్నింగ్ వర్క్ నేను మళ్ళీ ఫ్రెష్గా అవుతాను, మళ్ళీ జాబ్కి వెళ్తాను, నా వర్క్లో కొంత హార్డ్ వర్క్ ఉంటుంది కాబట్టి. హియర్ ఇన్ దిస్ కేస్ we need to ask him, is there any options of getting relief? Then he will think. And he will identify, my belief system is very rational. నాకు వేరే మార్గం ఉంది కదా, ఇంటికి వచ్చి రాగానే నేను ఆ 400 స్పెండ్ చేసే బదులు 100 రూపీస్తోనో 150 రూపీస్తోనో ఇంటికి ఏదైనా తీసుకువచ్చుకుంటే అందరం కూర్చొని తినగలుగుతాం కదా, అందరం కూర్చొని హ్యాపీగా ఉండగలుగుతాం కదా. సో దట్ ఈస్ ద వే వీ నీడ్ టు ఆస్క్ హిమ్ rationality ఆఫ్ హిస్ బిలీఫ్ సిస్టమ్. Identify your irrational belief system by asking yourself why you feel the particular emotions you do. Very clearly it is given in your textbook, in your book. Just you need to identify your irrational beliefs by asking yourself why you feel the particular emotions you do. So then he will think himself, why I am doing this? If there is any other emotion, other modes, other options, why I am doing this thing? So he will identify his belief system is a rationality or irrational. Then second is evaluating the consequences based on his irrational belief systems. So he has to face negative consequences, no?
Yeah.
So those negative consequences, evaluating from yourself, from other end also. Ask him, this is the way you have to spend this much of amount. So generally what we do, so we will ask him to, ask that person to calculate monthly how much you are spending for this particular issue. Sir, 12,000 rupees. How much it costs per year? 1,44,000. Since how long you are doing this? So since 5 years. So just you calculate 1,44,000 or 1,50,000 per year, 5 years.
How much?
How much it is? Around 7 lakhs it is. 7.5 lakhs. ఈ 5 years లో నువ్వు 7.5 lakhs ఖర్చు పెడుతున్నావు కదా, ఈ 7 lakhs 5 lakhs 7.5 lakhs ఎక్కడో ఒక చిన్న జాగా తీసుకుంటాను, ఇంకెక్కడో నువ్వు సేవ్ చేసుకుంటాను, ఇంకెక్కువ అవుతుంది కదా అమౌంట్. అన్నెసరీ యు ఆర్ స్పెండింగ్ అమౌంట్. మరి దీని వల్ల ఏమో ఉపయోగపడుతుందా ఫ్యామిలీకి? నో. సో దిస్ ఈస్ ద డిఫరెంట్ consequences. Ask them to evaluate. Emotions such as anger, anxiety, and depression often seen natural, but they don't have to happen. Rather than
అలాగే సార్, థ్యాంక్ యూ.
okay, yeah.
Thank you.
So some sort of self-defeating system. So by doing this, once you have identified an overly demanding or irrational belief system. So for example, it is gratifying when people you cherish love you in return. But if they don't know, continuing to pursue them or insisting that they must love you will only be. So some sort of irrational thoughts, irrational, what is emotions, like I mentioned. So all people, I have to be loved by all people. So I had to loved by my classmate. Is it possible? So if you tell her, so I am in love with you, I am in love. So reciprocally, other side also to be there, no? Is it not? Is it possible to love? So once you have some sort of emotion with other person, the same emotion, how can you expect from others? It's not possible. No, that is irrational thoughts, irrational belief system, irrational emotions, no?
Yeah.
So these emotional irrationality we have to explain to the client. So slowly, he will think, as I mentioned in the initial class also, psychological counseling guidance is different. Psychological counseling is that aspect. We empower the client in order to sort out this issue, in order to solve this particular issue. Ask them to think on their own. Ask them to understand their own. Counsel them to help them, not to not to approach the counsel for every. That is the guidance. Guidance is different. Counseling is different. Then in some cases, if the irrational emotive thoughts, irrational emotions, so we need to address those irrational emotions. In some cases, in some situations, if the is some acute cases, some sort of severe cases, what to do in some severe cases? So psychoeducation means psychological education. This particular case, sometimes it's not possible to directly give to the counsel to the particular cases, because they may not be in a position to understand whatever the tips, whatever the explanation, whatever the inputs we will do, they may not be in a position to understand. That means that cognition is totally deteriorated. What happens in some cases? They'll take only this type of addiction, but remaining food habits, they don't have proper food. They won't take proper food. Okay, slowly. So their body will weaken. Then finally, what happens? Their that is brain also. So that negative consequences not only in the physical aspects, slowly to their mental process also. In acute cases of this type of addictions, this type of cases, what happens? Psychosis means some sort of hallucinations, because they will take only the particular alcohol, but they won't take proper food. Okay, physical aspect, because physical aspects, is health. Once the physical health is weakened, that is, physical health is disturbed, automatically the thought process also will disturb. So here, if it is possible, better to give that is psychoeducation to the client or the person, if he is not in a position to understand better to give the therapy or psychoeducation to the caregivers, because he is not in a position to take the counseling. Better to give the counseling to the caretakers. Got it? Individualized counseling means that if it is possible, better to give the counseling to the particular case, or else we have to give psychoeducation. Psychoeducation means whatever the psychological things, whatever the psychological aspects, we better to explain to the direct individual or other family members. So some cases what happen, due to their disturbed physical status, some sort of hallucinations, delusions, means whatever we see, their perception is somehow different because of disturbed perception, deteriorated cognition. Okay, so their thought process is somehow disturbed, means hallucinations. Okay, so some in some wrong with their wrong belief system, so they think in a different way. So this type of behavioral aspects we will observe in their cases, that is in the addicted cases. Okay, rational emotive therapy is one important technique that we have to provide. In some cases, ABC model. ABC model, as I mentioned, activated event, behavior system, that is belief system, and the consequences. Then in some cases, what happens in rehabilitation centers? It is group therapy also we need to give. Group therapy means, for example, these type of drug addicted or substance abuse cases, from 5 or 6 cases are there in the same way, same it's same issue. Better to form a group. Okay, so group counseling also possible in, especially in the rehabilitation centers. So same type of people if observe, so better to give the rehabilitation services with the group counseling. So in this group counseling, role play is one important technique that we will use in this particular group counseling cases. So role play means, so one is that role play has some sort of emotive, cognitive, and behavioral components are there. If you observe this type of cognitive, behavioral components and the emotive components. So these therapists are therapeutical professionals. What they do, role play. If any case is observed, so better to ask the particular case, some sort of role playing. For example, so this is the consequences you have to face if you continue of taking this particular substance. So what happens? Just ask them to play that to play as a to visualizing. Okay, role play is one technique, visualization is another technique. Okay, some sort of over generalization. Some people, because of their over generalization, for every case they will apply to that particular issue to their self. Okay, so this is a process of holding extreme beliefs on the basis of a single incident. For example, any incident is happening, so what happens, that incident they will apply to their own self. Okay, so this is a tendency of believing that if this incident happens to me. Okay, and another thing is that personalization. This is a tendency for them to relate external event to themselves. Personalization means what are the external things if they observed, so they apply those personal those incidents to their personal aspects, external event to themselves. So this type of overgeneralization, this type of personalization, and another important thing is labeling. So they will have some, they themselves think that I am waste fellow, I am helpless, I can't do anything. This type of labeling, that is also one reason of their, as I mentioned, in any case, when we are addressing those issues, better to identifying the reasons. One reason is that their wrong belief system, number one. Number two is that irrational belief system. Another thing is that deteriorated cognition. So fourth reason is that irrational thoughts, then irrational belief systems. So these are all the various reasons we have to identify. We need to understand. Okay. So which model, whether it is CBT, cognitive therapy, behavioral therapy. Cognitive behavioral therapy means it's a one type of psychotherapy based on the assumptions of the is behavioral aspects. Okay. Any maladaptive behaviors or any type of wrong belief system. So better to apply this cognitive behavioral therapy. It's one type of psychotherapy based on the primary source of psychological distress or maladaptive patterns in their behavior. So this cognitive behavioral therapy is based on the behavioral theories. Okay. Second is ABC model.
Excellent,
Hello.
sir.
Yeah.
Sir, what is role play, sir?
Role play means we just ask one person in that group. We just ask that particular person to play a role, like a parent role. For example, if he is a disturbed person, how after some 3 years or 4 years, what will be his position in that family? That is one role play. He has to play one role in that particular group.
Sir.
Got it?
So that he will visualize what happens.
Yes, he will. If I continue in this habit, so this is the consequences I have to face after some 3 years or 4 years or 5 years. Okay, the family members they won't allow me to come to the family. They won't allow me to mingle with the family members. That type of visualization.
And visualization is also similar to role play.
Visualization is different. Role play is different. Visualization you will visualize that particular situation to this case, to this person. So we will take him into that particular situation by understanding that, by visualizing that, by thinking that, by imagining that. That is visualization. Whereas role play, you just in that particular group, you ask a person to play a role of that particular person. As a father, for example, head of the institution. For example, if you head of the institution having some sort of habits, after some 2-3 years, the subordinates, they won't bother about, they won't care him. No, this type of role he has to play. We need to show that role. We need to show that play in the group. That is role play. Visualization is we won't show anything, but we will ask the particular case, particular person to visualizing, to imagine.
Okay,
is it okay?
Thank you. Thank you.
Yes. So these are the various techniques we will use in the CBT, cognitive behavioral therapy cases. Okay. So this cognitive behavior, the backbone of this cognitive behavioral therapy, as I mentioned, is behavioral techniques or behavioral therapy. Aaron Beck Aaron Beck is the profounder. So Aaron Beck and Illis. So in REBT, the founder of REBT is Illis, and the CBT is the Aaron-Beck. Okay. So these Aaron-Beck and Illis, in addition to these behavioral therapies, behavioral theories, and psychoanalytic theory also, they applied in this CBT. For example, how they applied the psychoanalytical theory means, for example, id characteristics are more. As I mentioned in the previous class also, in psychoanalytical approach, the structure of mind we already discussed. One is id characteristics, superego characteristics, and ego is the normal character. The ego is the as I mentioned, ego is the mid path between the id and the superego. What are the id characteristics? Animal trait, pleasure seeking principle. Okay. So if I want to do something at any cost, whatever the cost may be, I will complete that activity. I will complete the task. But what are the negative consequences? I won't bother about the negative consequences. That is the it characteristics according to the psychoanalytical theory. Why this cognitive therapy is linked with psychoanalytical also means, so as I mentioned, the backbone of this behavioral is the behavioral therapy. Some cases, Sigmund Freud's psychoanalytical approach also linked backbone to this particular, linked with this CBT. As I mentioned, if it characteristics are more, so they won't think about the negative consequences. Okay. So their think is that their understanding is that, so I have to do whatever I want. If I want to take this substance, definitely I will take it. What are the consequences? This is one type of id characteristics. So if you find this type of id characteristics, slowly, we need to ask them, if you continue of taking this substance, what is the consequence you will face? This type of visualization we have to. Some sort of super ego character. Super ego characters always they'll tell the moral values, but they won't follow. If it is not possible to follow those moral principles, so that also we have to ask them: is it possible to follow those things? So in this way, both psychoanalytical approach of Sigmund Freud and behavioral therapies, behavioral techniques also you can apply in the CBT. Rational emotive therapy and ABC model. Both are important techniques when we want to approach, when we want to change their these cognitions, or you can say emotion. If there is irrational emotions, as I mentioned, this type of techniques we can use. And other reasons of this wrong belief system means overgeneralization, personalization, labeling. Everything they will apply to that own self. What are the things, what are the events happened? So they will apply to that particular thing. More generalization is that. Another one is the humanistic approach of Carl Rogers. Humanistic approach of Carl Rogers. As I mentioned, Carl Rogers' humanistic approach is significant approach. It's the most important approach in any counseling procedures, in any counseling process. Carl Rogers always talk about the self-awareness, self-acceptance, self-realization, self. In counseling, always we better to ask the particular case or the person to identify their self-awareness, self-acceptance, self-realizations, self-understanding. So person-centered therapy, according to the humanistic approach, what is the main therapy means? Person-centered therapy. Person-centered therapy means always we have to give the counseling techniques, we have to use the counseling tips based on the person, based on the client, his ability, his understanding capabilities. That is known as the person-centered therapy. In this person-centered therapy of Carl Rogers, there are three important aspects. One is empathy. Second is unconditional partial regard. Third is genuinity. In humanistic approach, the person's abilities we have to understand first. Ask the person to identify his abilities. Also ask the person to identify his negatives also. That means insight, improving their insight. Insight means just you need to see your own self, improving the insight. So in some cases, they don't know what is that their competencies. They don't know what are their negatives. Here in the humanistic approach of person-centered therapy of Carl Rogers, as I mentioned, every therapy is having some sort of foundations, psychological foundations. CBT foundation, the fundamental theory of the CBT is the behavioral theories and some sort of psychoanalytical theory. Same way, in person-centered therapy, the foundation, psychological foundation of person-centered therapy is the humanistic theory. The foundations are theories, then therapies, then counseling process. In counseling process, if you want to apply the person-centered therapy, the backbone of person-centered therapy is the humanistic approach of Carl Rogers. In humanistic approach, self is the main, self-actualization, self-realization, self-awareness, self-acceptance. To improve the self, so insight improve is the must. Improving their insight. Ask them to identify their abilities. In order to identify abilities, so the person, the client, the subject, the person, the client, the patient, in a position to identify their abilities, automatically he will be in a position to identify their negatives also. That is the reason we will ask him in the first session or second session. You just list out your positives. Then you also you list out your negatives. When he identify the abilities, when he identify or she identify his positives, we will ask him to improve their negatives or positives or the competencies. When they identify their negatives, we will ask them, we will tell them to reduce their negatives. You got it? Hello? Hello?
Yes, sir.
Yeah, this is the way of giving therapy in person-centered therapy based on the Carl Rogers humanistic approach.
Sir, on which basis do we select the approach, sir? Is there any particular method?
Particular method means, see, depending on their understanding capabilities.
Can you please further explain, sir? Understanding means for which subject or what is the method adaptable?
So, for example, he is educated. In some cases, though they are educated, they will have some sort of conflict in their family. And maybe some job place. Some sort of problem solving. The case may be that he is in a position to solve their issue, but problem is that he is not in a position to decide which option he has to do.
Okay, sir.
For example, in some cases, after completion of my master's degree, what to do? Whether I want to go for other professional courses or I want to go for marriage, job. This is one type of conflict. In that case, personalized therapy we need to do. That is person-centered therapy.
Okay.
Okay, balance sheet we have to balance. One system is the psychological balance sheet we have to prepare. Option 1 and option 2. So what are the positives in the option 1? What are the negatives in the option 2? In some cases, some that is bank employees, they will get the promotion, but the posting will be some sort of at is northeast area. Yeah, promotion and transfer not in this place. So they maybe belongs to the particular Hyderabad or some other Telugu area, but their posting is northeast states. Promotion is one thing. So here the conflict is that I want to cancel my promotion and stay here only. That is one option. Second is taking the promotion and post to some area that is northeast area, it's remote area. Got it? So this is the conflict. Yes. So here on that psychological balance sheet we have to prepare. So first option, what are the positives? In the first option means from taking the promotion, going to some other place. So there one positive is that, so promotion is one important aspect. That is one positive, number one. Second positive is that, second positive point is that increment of their salary. Number 2. Okay. Number 3 is that is status. maybe manager or chief manager. 3. So in the first option, there are three positives. Negative thing is that, so that is expenditure. So here they need to live far away from the family, from the native place. Negative. Second is the children health, the education may be disturbed. Third is that weather is somehow different from the southern part and the northern part. That weather conditions are different. So fourth, fifth, like. So here, just example I'm telling you.
That's right.
So 3 positives and 5 negatives. Got it? In the second option, now, second option means staying here without taking any promotion. Here, second option is that. So one is that pillar education will be it is good, the same environment. Okay, you will live with the family members. The expenditure will be less. No transport expenditure, no other expenditure. Okay. So this type of, for example, if 5 positives are here, only 3 negatives are here in the second option. So overall here, second option positives are 2. In first option, negatives are 2. So which option you have to choose? Second option. Got it?
Yes, sir.
This is the way we have to prepare. This is nothing but psychological balance sheet, especially the conflict. Any conflicts are different type of conflicts, approach conflict, avoidant conflict, approach avoidant conflict. We have 3 types of conflicts. No, approach means both are the favorable conditions. That is approach conflict. One positive and one negative. So one is favorable, second is unfavorable. That is approach avoidant conflict. Third is the avoidant conflict. These are the different type of conflicts. So in this conflict resolution, so better to choose the person-centered. Got it? Based on
Yes,
the
sir.
personalized situation.
Yes, sir. Thank you.
So now we will conclude here. I have some other program today. Okay. So tomorrow we will elaborately with our PowerPoint presentation. I will explain. Anything for last 2-3 minutes?
Okay, thank you.
Any doubt? Okay, that's nice. Any doubts? Anything? Hello.
Yes, sir.
No doubt, sir. Thank you.
Yes.
Sir, is the class concluded, sir?
సార్ పీపీటీ నోట్స్ ఇస్తున్నారు సార్.
పీపీటీ నోట్స్ ఇస్తామన్నా. పీపీటీ కదా, నోట్స్ ఉండదు కదా మన దానికి. పీపీటీ ఓన్లీ పీపీటీ.
పీపీటీ ఇస్తున్నారు కదా సార్.
హలో. హలో.
పీపీటీ ఫార్వర్డ్ చేస్తున్నారు కదా సార్.
లాస్ట్ క్లాస్ చెప్పాం కదా మీకు. మీరు ఉన్నారా లాస్ట్ క్లాస్ లో?
ఉన్నాను సార్.
అది ఫార్వర్డ్ చేయమంటారా మీకు?
ఫార్వర్డ్ చేయండి సార్.
ఓకే, నేను ట్రై చేస్తాను. రేపు ఉంది కదా మన క్లాస్.
ఓకే సార్. ఓకే సార్. థ్యాంక్స్ సార్.
Sir, tomorrow what units you will be covering?
So remaining some 2 units, previous unit and today's unit. I'll show the PowerPoint presentation. By showing the PowerPoint presentation, these 2 topics I'll complete.
Which will be unit 4 and 5, huh?
4 and 5? Now we are in
No.
the 17th unit, 18th unit now. Block 4 you are talking about, or unit?
Block
No.
4, 19th unit. Sorry,
Yeah,
covering
only
humanistic approach. 19th
Yeah.
unit, 19.2.
Okay.
Right.
Person-centered therapy and humanistic approach.
Yes.
Tomorrow what means what you will be covering, sir? in tomorrow's class?
Then we will cover both the previous 18th and 19th unit, probably 20th also.
Okay, sir. Thank you, sir.
Thank you, sir.